Thank you.
Our next presenter is Dr. Lauren Brookman-Frazee, a professor of psychiatry here at UCSD, also the Associate Director of the Child and Adolescent Services Research Center, and the Research Director of the Autism Discovery Institute at Rady Children's Hospital, San Diego.
So I'll be talking about designing interventions for end users. I did not plan to be an intervention developer. That was not my goal, and I've spent the past 10 years doing this. So this is that kind of flexibility we've talked about. So I'm focused on interventions for children with autism. We know that children with autism are served in multiple publicly funded service settings for their various needs in this complex population. Mental health services are particularly important because we know that children with autism have high rates of psychiatric comorbidity. And so mental health services play a really important role in serving this population. So we know of those children who are being served within mental health services, most of them meet criteria for more than one non-autism disorder. So we call it autism plus. But what's common across these kids is coming to mental health services for challenging behaviors. So that's how, regardless of their pattern of comorbidity, they're coming for challenging behaviors. This is what's interfering with their functioning and with their family's functioning. So as part of my needs assessment, early on in my career, we found that therapists were desperate for help serving this population. They said, we need tools, we're not trained with this population, and we're seeing a lot of kids who have autism. So we took this information that we learned from therapists, we partnered with community providers, organizational leaders to develop the AIM High intervention that was intended to be delivered by mental health providers who don't specialize in autism. When we developed the clinical intervention, we also concurrently developed a therapist training model that takes about 6 months to deliver, and therapists, our partners, said you have to have certification. We need to be able to be certified in AIM High. So we've done that. After a pilot study, we just wrapped up a hybrid effectiveness implementation trial in which we were really primarily testing the effectiveness of this autism intervention when delivered in publicly funded mental health services. So as far as the aims of this trial, primarily we're interested in clinical effectiveness, but then also are characterizing the implementation process to inform the next study, which is the test of the implementation intervention. So we drew therapists and clients from within almost 30 programs in San Diego and LA County in their children's mental health services, randomized the programs to either immediate training or delayed waitlist training. We found that those children who had therapists trained in AIM High showed greater reductions in their challenging behaviors than those who had usual care, and therapist fidelity moderated the impact. We found that most therapists learned AIM High, and there's lots of very positive impacts on therapist practice, but there was a lot of variability in therapist delivery of AIM High. So we were interested in, well, what explains variability? And we found two things: leadership support and provider engagement and motivation, that these impacted their outcomes. My colleague was conducting another autism intervention effectiveness trial and found similar results. So that led us to our current study, which is an implementation and effectiveness trial, Hybrid 3 design, where we're testing the impact of different implementation strategies when delivering AIM High and another autism intervention called CPRT. So we have 2 R01s that are linked, in which we're testing implementation strategies in Sacramento, LA, and San Diego County with my colleague Aubin Stamer and Anna Lau. We are testing 2 implementation strategies. One of them is leadership focus, which is an adaptation of Greg's loci intervention, and one is a motivational enhancement provider level intervention, in which we're applying motivational interviewing to the training process. And so in this study, the primary aim is the implementation aim. So we're testing the effectiveness of the implementation strategies in combination and individually. And our primary outcome is therapist fidelity, therapist persistence through the training process. We have these two studies that are linked. We're pooling our data with the intention that through this research, where we'll be building the capacity in the community to serve this complex population that's growing. And I think some highlights from this research are really that community-partnered approach, applying a hybrid design across this research, and then really thinking about the end users of our interventions from the beginning. And that's where we are. Thank you. Done? All right, yes.
Leadership, like what's the specific intervention on the leadership part?
Yes. Yeah, so so in the programs that are randomized to receive our Teams Leadership Institute is what we would call it, we have a workshop in which we go through and this is pulled from Greg's loci intervention, of really the constructs of implementation leadership and implementation climate. As part of that intervention, there's a 360 degrees assessment. Greg mentioned that earlier, where leaders then during their workshop, they receive feedback about their implementation leadership and the climate related to implementation. And then they leave the workshop with a plan of how they are going to implement AIM High. So it's focused on AIM High, or in my colleague's link study in the classroom PRT intervention. And so then they develop a plan, and we call it the TLI plan, and then there's coaching every few weeks. Our coach follows up with them on their plan and their progress towards their goals.